So Danny has progressed to the passive range of near 50 to 70 degrees depending on the day. And so what we're doing is a warm-up prior to manual techniques. So he's come into the clinic, and we're going to just utilize the Ranger to support that free spin of the humeral head in the socket to achieve that relaxation, supportive circulation. We have his hand on back to be more natural, and you can look at the tube as the arc goes across. So that helps him to let the tool support the passive motion, because the inclination is when you start going up, the brain wants to help, and so it's inclined to start hiking the shoulder. So we're not wanting to utilize that at all, and especially before manual efforts. So Danny is really doing quite well here, and we're just going to take that success into manual passive range of motion, and then we'll come back and we'll see how that goes, and we'll utilize this same process again to work within his gains of manual passive range of motion. So we have just used the Ranger as a warm-up to pre-manual passive range of motion. And so Danny is currently in the neighborhood of 70 degrees. And so we're just going to work to that range how you normally would with manual passive range of motion, but recognizing using the Ranger prior to your manual techniques, the shoulder is really supple. The patient is very relaxed, so you don't have to use your valuable time trying to get the patient to relax with your hands. You can go right to in ranges and be more effective and more connected with the patient's nervous system to make that progression therapeutic versus a lot of labor for both you and the patient. And then the goal or the process after your manual efforts are to put the patient back in the Ranger and utilize the progression of motion that you may have gained to try to utilize that to produce a carryover so that that motion lasts. You feeling okay, Danny?
Mm-hmm.
Okay, as you just saw with the manual passive range of motion, we were in the neighborhood of actually beyond 70 to 80. And so Danny is now going to utilize that motion, a combination of still assisting him, but letting him actually do more and more of the motion on his own, but still with the left arm doing all the work. It's a little harder, but remembering to let the arc of the tool support that capacity. And then the hands of the therapist being free, I can just monitor other aspects of the supportive movement, just a recognition of the role of the scapula as we get up into 70 and above to rotate. And we're still monitoring the free spin motion of the humeral head in the socket, but that becomes a combined contribution of the scapula and even the torso. And so all those earlier aspects of visualization and authenticity of movement are starting to come into play so that the nervous system can make sense of the support of movement. Danny, let me ask you to put your right foot just a little bit ahead of your left. And that helps some patients just to actually from the ground up support movement. Just a little more natural to get the whole body involved, and that's why we just have to monitor everything to keep the feet relaxed, the hands relaxed, and especially the neck and shoulder relaxed, and then he's supporting breathing. Because anytime we make a progression, the nervous system is going to fear that progression, so preservation of the calm will make sure that we actually can succeed with that gain. And then we can always go back down as a cool down. And so I'll bring you down a little bit. And even having him put his hand back up on top, and then that's just a more supportive position. So ending with the assurance that the nervous system is not going to go away feeling like it was overworked. and less likely to produce pain after the session.